The ASCERTAIN trial was a study that looked at the use of oral dacogen in patients with intermediate and high-risk MDS. And so previous studies have shown that if we could combine oral dacogen with a DNMT inhibitor, we could prolong the exposure to the drug and replicate more closely the exposure to the drug when it's administered IV. And this is particularly important for our patients with MDS because they spend a substantial amount of time in our offices receiving IV infusions of this drug when they could be out living their life. And so what we did in this study was patients were either randomized to receive IV dacogen during cycle 1 or 2, and the remainder of the time they received the oral therapy. And the aim of the trial was really to show that the bioavailability, the exposure to the drug was the same. And so in this study, we did demonstrate that exposure to dacogen, both whether it was delivered IV or orally, was the same for these patients. So this really will be a major breakthrough for these folks, and I think, again, can move treatment more into the outpatient setting, leaving patients at home for longer periods of time. The other thing for consideration is that as we look forward to incorporating other oral agents in combination, we could be thinking about changing regimens that previously were IV to a completely oral regimen that could take place at home.